All right, we are go.
Welcome in, everyone. Thank you for joining. We'll just give everyone a couple minutes to join the session, and then we'll kick things off.
I'm just very excited to have fast internet from Hornby Island, courtesy of Starlink now. So this is, it's a big day.
All right. Well, as more folks continue to join us, we'll just kick it off with a few opening remarks and housekeeping notes before starting the official program. So hello, everyone. Thank you for joining us today for Thrive Health's March 2022 Grand Round Speaker Series. Before introducing our speakers today, we wanted to open with a land acknowledgement. We're hosting this session for those of us in Vancouver from the unceded and ancestral territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And we're lucky to have both team members as well as attendees today joining from other territories across North America as well. So again, welcome and welcome back if you have joined us for these sessions before. My name is Marie and I manage marketing and communications here at Thrive Health. Today's discussion will be on how new technologies can change the landscape of youth mental health services. And before jumping in, just a few quick housekeeping notes. You will all have been muted when you come in. Please keep yourselves on mute. And please use the Q&A tab in Zoom to submit questions throughout the session. We'll start with some discussion between our speakers, and then we'll move to Q&A where we'll be able to take up the questions that come in during the session, as well as during the Q&A portion. So if you have a question, please submit it and hang tight. We'll get to it later on, and we'll endeavor to answer every question that comes in, of course. We'll be monitoring the tab to make sure that we don't miss any. Please also note that the session will be recorded and that we will be live streaming to our YouTube channel today as well, which is very exciting. So without further ado, I'll introduce our speakers, and then we're going to play just a short video to set the stage before passing the mic over to David. So we are joined today, very excited to have Dr. Steve Mathias, who is the Executive Director of Foundry. Foundry is British Columbia's community-based, integrated health and social service network for young people and their families. Steve trained as a psychiatrist at the University of British Columbia and has obtained fellowships in both addiction medicine and child and adolescent psychiatry. As a medical student, he co-founded the Community Health Initiative by university students, which saw integrated health and social service centers open in Vancouver's downtown east side, which were uniquely staffed by volunteer students from 10 faculty and departments. And this involved both working evenings and on weekends. In 2009, Steve co-founded the Inner City Youth Program, which was the first intensive case management team in Canada to work with homeless and precariously housed youth living in inner city Vancouver. In 2014, Steve submitted a proposal to the British Columbia Parliamentary Select Standing Committee on Child and Youth Mental Health, which led to the funding of the initial 5 Foundry centers. And from 2017 to 18, Steve was also the co-head of the Department of Psychiatry and the physician program director at St. Paul's Hospital here in Vancouver. And joining us from Thrive Health and in conversation with Steve today is our co-founder and executive chair, David Helliwell. David has an extensive background in software entrepreneurship in the healthcare and energy industries. His last company, co-founded with Thrive co-founder Greg Kerfoot, became the world's leading commercial energy intelligence software company before its sale in 2015. Following a family sabbatical in 2016, David co-founded Thrive Health in 2017 with Greg and his brother, Dr. James Helliwell, with a mission to make healthcare work better for everyone by using technology to stop patients from falling through the cracks. David also serves as a mentor and angel investor with international health tech startups through the Creative Destruction Lab. He is a board member at Life Sciences BC, and he has also served 2 terms on the advisory board for the National Research Council's Industrial Research Assistance Program. So welcome both Steve and David today. As mentioned, we're going to play a very short video here. We'll just go to the next slide. And after playing this video, I will stop sharing and I will pass to David to start our discussion.
Everyone seems to have an opinion on everything. Except, no one seems to know anything about me. For that, you need to listen and hear what I have to say.
I don't want to be labeled or defined by a check mark in a box. I don't want to be shuffled into a new line that looks just like the one I came from.
I don't want to see a professional who thinks they know more about me than I do. I don't want to be part of a cookie-cutter system because my life doesn't fit into a mold. What I want is to go somewhere that thinks differently and takes the time to learn what I actually need.
I want someone who'll listen to how I feel, rather than tell me how to be. Who recognizes that what I'm going through is something the world has never really seen before, because the world has never really seen the real me.
I want people who are willing to challenge the system, who aren't afraid of change. People who can see problems as more than just right or wrong, because there's more than one way to live a good life.
I want an organization that puts us and the people we care about at the heart of the solution.
Who shapes our world with us, not for us, and lets us define what health means.
We want a place where we can reach out and get the things we came for. You know, the things that help us live, not just survive.
Because the youth of today need more than what's been done in the past. We need change.
We need somebody to care. Someone to care about us. We need more than just healthcare. What we really deserve is care in every part of our lives.
And over to you, David.
Great. Thanks, Marie. And thank you so much, Steve, for joining us. And thank you, everybody who's tuning in to our webinar and we're actually, I think, our first YouTube live stream. So, I mean, that's a great video, Steve. And one thing that, you do a nice job of playing on it at the end in particular is the word care. And certainly as someone who's gotten to know you, I mean, the word care applies a lot. I mean, if you look at how you live your life from day to day and year to year and the things you're doing is really caring for people who need it most. And so thank you for that. And you've built something wonderful. And in this conversation, the main idea is to help to tell more people about what you're doing at Foundry and to learn from some of the lessons that you've learned from. Hopefully, some people on this call will be interested in following up with you for things that you might be able to take your chocolate and their peanut butter and make something wonderful. And certainly, in terms of the relationship between Thrive and Foundry, there is just this very strong values alignment, in general, in terms of helping people who need it most in the healthcare system, and then particularly with the attention to the youth mental health crisis that we're in the midst of. And we really want to do more, as a company, but also as the individuals who work within Thrive to make more of a difference in this area. My brother James and our parents and our family have definitely felt it extra strong in the last year or so. When my nephew Harry, my brother's son, died at 16 after a series of mental health problems and drug use, and just the tragedy. And these things happen all over the place, and people don't talk about it very much. But we certainly would like to do everything we can to help other families not have to lose their Harrys. So it's something that we really are committed to helping with. And it's not like technology is going to on its own be the silver bullet to solve everything, but we think if we bring the pieces together, we can really do something special. So during the partnership that we've had with Foundry and Steve and his team. It's been a number of years that we've been in touch with one another and gradually doing more and more things together. You know, a nice way that we fit well together is, you know, Thrive is really dedicated to doing assessments, which are typically digital assessments and self-reported, sometimes by tests, and then guiding people through journeys, you know, which really fill the gaps between interactions with healthcare professionals and more formal parts of the healthcare system. We also, and maybe some people on the call will be interested in diving into some of this, is working with universities and schools as well. Through COVID, we've been working with 8 of the biggest universities in the country and have these hundreds of thousands of students, a lot of them in need on the platform, and looking at ways with these universities to do more to help them. And then one other dimension that it's just makes it a really natural fit is Thrive Health. You know, the reason we chose the name Thrive was wanting to help people to, you know, not just fix an illness, but really to thrive physically and mentally in their lives, and understanding that happiness and well-being is an important part of that picture. And so we've been from the start, you know, measuring people's levels of subjective well-being, happiness, and using that as an indicator of how resilient people are going to be through care journeys, and understanding that that's a part of the puzzle when you're figuring out what the right pathway is for different people. So that's enough intro from all of us to get this going. Now, Steve, wanted to pass it over to you to get a sense of, you know, we saw the video, but would love to hear about the needs that you saw when you set out to build Foundry, and what that journey was like to get it going.
Thanks, David, and really appreciate that introduction, and I'm sure we'll come back to several of the elements that you talked about throughout the course of the next hour. I just want to take a second and just acknowledge that I'm on unceded Coast Salish lands here, today known as North Vancouver, but very grateful to Musqueam, Tsleil-Waututh, and Squamish First Nations, and the lands that we find ourselves on. So yes, you know, the video that we just shared out is a video that we created after almost a 1.5 year long brand refinement process. And we're 7 years into Foundry and our journey with Foundry. And we realized that we really needed to go back to young people to hear from them to hear from them about what they really perceived as their needs and what Foundry's role was in their lives. And as you probably noted at the end, there's really not a lot around mental health support or substance use support. It's really about just finding a place where people care. And I think that that's been resounding for us since we launched the Foundry brand, that we really wanted to ensure that it wasn't a brand that would be necessarily, that there would be a risk of stigma coming from the brand. And when you think about resources and services that currently exist for youth, so many of them are labeled with the reason the young person is going. So we have child youth mental health clinics. We have, you know, reproductive health clinics or sexual health clinics. When you show up at sexual health and you're a 17-year-old boy, people know why you're there. And there's just a lack of confidentiality at many of these services. And so the idea with Foundry emerged really when young people kept saying again and again in the early 2000s that they had fallen through the cracks, or that they were really struggling to access resources, or that they felt that the resources themselves, the services themselves, were stigmatizing. And so we went about listening to young people and their family members to hear what they were looking for. And the idea of this type of one-stop shop emerged, this idea that all of the health and social services that youth would need could be co-located and in some cases integrated to work better together in one place. And that's really when that idea, that concept of Foundry emerged, and was, as you shared out, or sorry, as Marie shared out, was delivered to the BC government in 2014, that concept. And so we started with 5 centers, plus our pilot center, which was Vancouver Granville. We really wanted to make sure that our centers reflected the geographical diversity of the province. And so the first Foundry center to open was in Camel River, and soon to be followed by centers in Prince George and Kelowna, the North Shore, and Abbotsford. And then we opened up another 5 centers. So today we're at 11. And in the next year, we'll be opening five more. And the following year, we'll be opening up another 3. And then the year after that, hopefully, we'll be opening up another 4. So we'll eventually get to a network of 23 centers. So it's really, really kind of unique in Canada. Ontario has a similar model that's predominantly focused on mental health and substance use, but don't have this full suite of services that we tend to have. And the idea really is that a young person should be able to walk in and 9 times out of 10 be able to find what they're looking for when they walk in. And one of the entry points, and I think this is where technology has really been important for us, is that we provide walk-in counseling. So if young people are looking for same-day service or within 48 hours, they typically can get that with a walk-in model. So it's not where you're sitting on a wait list for 6 months to get support for your mental health, but it's because something's happened in your life and you really want to talk to someone. And that was a really innovative addition to the services that already existed in communities. And we find that that's almost 12% of all our visits are for single session walk-in counseling. So that's a bit of a sort of a brief on where we are today with the centers. And when the pandemic struck, as most folks know, we really needed to pivot to the delivery of virtual services. And so we started with counselors that were in all of our centers working together to provide just something for young people around the province using MS Teams. But we had already been about 3 years into a journey of designing our app, and we were able to successfully launch that in the spring of 2021. And so all of our services now, our virtual services delivered by our virtual team, are delivered via the app, which incorporates Zoom, but also chat functionality, the ability to tell their story, and also to download any stories that young people want from our website. And that it's really like a communicator. And it's really exciting that we're at this place today. Over 5,000 young people have used it to access services, and that number obviously continues to grow month on end. And it's been a real eye opener because we are now aware that this is the type of platform that can be used in our centers as well. And we're going through a process of having that technology brought into our centers. So there's a lot happening at Foundry, and it's really exciting to see how young people have embraced the technology that we used, and that they haven't managed to break it because they co-designed it, and they co-designed it to be a relatively strong platform. So we're excited about that.
That's great. Good for you. So before I jump in with my next question, I see there's one question posted in the Q&A. I'll definitely put it out to anybody else. Oh, good. We've got a second one coming. Anyone else, please get your questions in. And what we'll do is we'll try to bundle them together so we can ask similar questions together if we have a lot of them. And don't be shy if you have partnership ideas. And Steve, maybe I'll ask you, one question about trends with technology, and then I'd like to get a sense from you about, what types of partnerships you're looking for, because you are definitely looking for, not being an island in BC, but really connecting with others both in BC and elsewhere. So let's quickly go back to, in terms of, yes, things have changed a lot during COVID for, electronic delivery of healthcare. But the habits of, as the father of 2 teenage girls, I'm generally aware of, of the trends of the channels and vehicles that they look at for communications. Are there any broad strokes of trends and changes that you've seen over the last couple of years, and where you see things going in terms of the most effective digital channels for engaging with the youth who you're involved with?
Yeah, I think where we've come to understand is that there is never going to be, in our space anyway, a fully digital solution to what is needed. And so the transformation we're trying to create is bricks and mortar transformation. So the idea that a Foundry Center is a community asset, it's a social asset. It's like you need a community center, you need a hockey rink, you need a Foundry, and every community should have one. And that transformation is just, for the foreseeable future, AI certainly will never, at least foreseeably, will not replace the opportunity, the ability to meet face to face and speak to someone, whether it's in person or through a platform like we've created. So we certainly see that this is something that that coming out of COVID, this is a hybrid model. It's one where young people need to have the options of doing either or, and that one of our managers, one of our Foundry Centers managers once said to me, the kids who only want to use technology probably need to be seen in person, and the kids who only come in person probably could use some technology. And I think that's, we have a lot of these types of dichotomies in healthcare in general, but I do think it reflects how sometimes, if for instance, a young person is working and they don't have, 6 hours to take the bus into an appointment and, get their appointment and go back, then technology makes a lot of sense. But if a young person is housebound and they're using technology so that they can stay housebound, then it may make more sense to encourage them to come in for a face-to-face and a walk around the park, and not use technology. And so but it's really broadened our opportunity. And obviously during the pandemic, it's been life-saving, I think, in many cases, to be able to continue to provide supports for young people using the technology. But I think ultimately what we'll want to do is continue to make the technology more user-friendly, add functionality. One of the things that we've started doing is providing groups, so through the platform. And so that for some young people, so Foundry is networked, so all of these centers talk to each other. And when you think about some young people who are, for instance, trans, or really are in a smaller community and don't have a safe space, a group of provincial young people, so that they can come together and have conversations that they can't have locally because of confidentiality issues, or because their family members may be involved in a health service provision. That's a safe space that we've been able to create with technology, and something that, again, it brings, the face-to-face of a group occurs because we have the technology in place. And so there's just so many options that are opening up with this. I think that there are some nice AI opportunities, but we just see so much more opportunity in the ability to network and connect young people from different parts of the province, and eventually maybe even across the country, to share out what experiences they're having.
Yeah, no, absolutely. And that's a great point. It's certainly something, we see all the time at Thrive, is there's always an optimal balance of, and it'll change for a person over time, of how much technology, how much in person. But one thing's for sure, that 100% technology or 100% without technology is never the right ratio. But somewhere on that spectrum is where it should be, and helping to make those make that flow work better. We've got a couple questions that I'll bundle together. The first two questions, each one has a few points in it, but they really revolve around the idea of longitudinal care and transitions between different caregivers, also transition from being a youth to an adult. And what's your the overall Foundry approach and philosophy for handling those longer term relationships beyond just the one-off
so,
meetings.
so a couple things that I probably forgot to mention is that each of our foundries are led by a nonprofit organization, with the exception of 2 centers, which are led by a health authority. But those nonprofit organizations then partner with other nonprofit organizations. And so they're able to really provide a spectrum of service. And so we have over 200 partners working to create Foundry. So Foundry is more like an umbrella term. We have an office that supports the creation of Foundry centers and all the work that goes into the service provision. But really, it's led by nonprofit organizations, community organizations. The walk-in counseling service that I described is only for about 12 to 13% of our visits. So we have lots of young people coming in for ongoing groups or ongoing therapy. And so sometimes they may be seeing a clinician, an alcohol drug counselor, or a therapist, and working with them long-term. The walk-in counseling is really intended to try to support young people who are in need today. We just haven't had a history of, other than crisis text lines, we really haven't had a history of services that are available on short demand or short notice, other than those crisis text lines and the emergency room. And so that is why we brought the walk-in counseling. When I mentioned it, it wasn't to suggest that that's all we do. So we do have youth coming in for longitudinal support. When it comes to the primary care conversation, a lot of young people, so what we have found is about 25 to 30% of our young people don't have a family doctor. So all our centers either have a nurse practitioner or a family doctor, and that's part of our model. And so a young person can, if they do not have a family doctor, quote unquote, attach to Foundry, in other words, come under the care of Foundry's primary care provider. And where we see that going, and the opportunity going, is that because we're working with local divisions of family practice, we are seeing the opportunities for those young people then to eventually move on to a family doctor in the community, so they don't have to stay with Foundry. We also provide episodic care. So if someone has a mental health concern or substance use concern that requires more than a one-off visit, then we provide episodic care. And then we also provide specialized care, particularly for young people who maybe need gender affirming care, or who also need opioid agonist therapy. And that's been one of the services that most, not all, but most of our foundries offer up. So it is, and it's a space that a lot of young people come to just appreciate as part of their community or an extension of their community. Some young people come in as early as the age of 12. So when you think about it, some young people will probably use our services for over a decade, which is really exciting, because the idea of having our services co-designed by young people, having peer support workers, which we can talk about in a bit as well, really creates a sense of community when young people come in. And so in some spaces, it's been called a movement. And we really get excited when young people take ownership of a lot of the activities that are happening in the center.
Great, and thanks for that. And maybe just to dig in a little bit on the transitions. So we talked about that for people while they're still minors. But how about that transition from being a Foundry patient to growing up and not being any longer? And it's something I feel quite deeply about as well. My wife Nancy and I have been working with a group in Vancouver called the Aunt Leah's Independent Life Skills Society for probably 20 years, and it's a pretty abrupt transition for people who are wards of the state to not wards of the state just on one birthday. I know you're a little more nuanced with that, but it's the same idea.
Well, ours goes to 2025. They're 25th.
And then it's still, yeah.
Well, each center, there are some centers that will hold on. I think it's fair to say that 18-year-olds aren't nearly as well equipped as 24-year-olds. And so that 6 years of extra service makes a huge difference. And, in some cases it's enough to get a master's degree. And we've seen young people go through and get their bachelor's and a master's before they finally transition. And it also allows us time to stabilize whatever mental health or substance use concerns they have. So that transition is made, it's not always easy, but it's made a lot easier by having that period of time go much later. And we do have young people who come in starting at 15, 16, who have been under the care of the ministry and just continue to work with us even after graduating from ministry services. And so we not only offer health services, so physical and reproductive health services, but we also offer social services. And so one of our initiatives is called Foundry Works, which allows for occupational therapists to work with youth who are trying to re-engage or re-enter the workforce. And that's a service that young people often come to Foundry to access before they access anything else. And that can be something that they access well into their 20s. And again, that idea that Foundry can be used for multiple reasons. Even if you don't have a health concern, you can still come in and access social services and get into some of our wellness activities as well. So I think the transitions are much smoother when youth are coming out at the age that they're coming out.
Right. There's one follow-up question there on whether 24, 25 is a hard stop for individuals and families with the Foundry model.
Typically what we do in our centers, and it does depend a little bit on each center, but typically what we see happening is that they start that transition process. They start to have those conversations. If it's someone who's, if it's walk-in counseling, then no, you're not gonna be able to access walk-in counseling at 26. But if it's someone who's been having an episode of support or primary care, for instance, then the Foundry crew will work on as best as possible supporting that young person to find, at worst, a walk-in clinic to go to or a family doctor. And this is why, again, being part of our conversations, being part of the primary care networks allows us, I think, to have more constructive conversations with the divisions of family practice to ask for their help to take on some of the young people who may be graduating.
Okay, great. Thank you. So one question, you mentioned a bit about the peer support workers, and first I'll also remind people, please do get your questions in, and we can get back to those as we go through the conversation. But this is a really interesting area around the benefits of having peer support workers, both to the people who they're providing the support to, but also to the peer support workers themselves. And one of our research partners, Dr. Lara Aknan at Simon Fraser University, has done a lot of research on pro-social behaviors, where everybody feels better when you're doing things to help others. Is that something that you've started to see within your support networks, and have you had any ways of assessing the benefits to the person giving the support versus receiving support, and any trends there?
Yeah, the literature on peer support is actually is quite strong, and where we, I think, became innovative was that there weren't many. Well, we couldn't find any training programs for young people to be peer support workers. So that youth context wasn't really reflected in any of the training that we found. And so one of our core services at our centers is peer support. And the idea for us is to create ladders of employment for youth. When you think about it, for a 19-year-old looking for a job, it's Starbucks, it's the service industry, maybe landscaping, but there are very few entry jobs that are not volunteer anyway for young people into social services. And so we created a training program for youth to become peer support workers. And we now have peer support workers at our centers, and they're there working typically afternoons and available to see young people when they come in. It helps they help young people navigate services. We also, in some of our centers, have had family navigators, so family peer support workers who can support parents and care providers. And it's been just it's been an amazing service. And so our virtual care staff, one of our first 2 services was walk-in counseling virtually and peer support. And we have 4 peer support workers that work with us at Foundry Virtual. And they're available to help youth. They're often the first initial point of contact when youth are reaching out to Foundry Virtual Services. And what we find is that a lot of young people are just looking to try to understand how to navigate care. So they're not necessarily looking for Foundry Virtual to provide clinical service. They're just trying to understand, okay, so if I need help, where do I go? And our peer support workers are fantastic for that. But the app has been invaluable. Our Foundry BC app has been invaluable in supporting the conversations that happen between young people and peer support workers. And as we dig in and create our own body of evidence and understand, the value of those peer support workers, we're really seeing that it's incredibly transformative for the young people who are working as peer support workers. And it's also sometimes the only service that youth will access when they walk through the door is with another peer. And it may take a couple sessions before they will actually see a clinician. So it's really awesome to see.
That's great. Thank you. Maybe on that note, we have a couple more questions about the platform itself, and a couple specific questions on, is there anything that's missing in the platform today? And then what's the biggest value add that could be implemented that's not in it today? And maybe that's 2 sides of the same coin.
Yeah. I see that there's a question I haven't quite answered from Mark Peltier around caregivers. And I just want to highlight that I think in all our survey work and our evaluation work, care providers find Foundry really welcoming and a safe space for them. We include family members as much as the youth wants in the services we provide. And we also have training in what's called emotion-focused family therapy, which again was something relatively new in this space. But we've trained dozens of trainers in this area who've in turn worked with parents. And the idea really is to support parents in their conversations with their young people. And that's been a really, I think, innovative service that we've provided, along with the solution focused work that is the walk-in counseling. So we also have family peer navigators in our virtual program. And when you look at the app, it's often the adults, the parents, who struggle to use it more than the kids. So that probably doesn't surprise anybody on this call, but we do have lots of care providers who are downloading the app. So a key component of what's missing. So this app for us, it has been quite iterative. It started off like the first original pitch when we kind of started this project was more like a PHR, a personal health record. But as we co-designed it with youth, they really wanted more of a communication tool. And so it shifted from a PHR to a communication tool. It's been really effective that way. And I think what's missing is probably more functionality around what it would look like if it was a communication tool and PHR. And so having more like medication modules and having potentially, access to care plans. Those types of features are features I think that we'll be adding in the future. But when we talk to young people, for the most part, they're pretty excited about what's there. We have action plans that are coming in, or an action list that will be added in the future. And it's, if you look behind me, you'll see these tablets that are just over my shoulder. This is the waiting room in Abbotsford. So those tablets use a software from a company in Montreal. Those tablets are called Toolbox, and that's how we collect a lot of our data. And those are synced to our app. And so a lot of our surveys now are completed using the app for youth. So we're able to collect a great deal of data. We've collected data on over 33,000 young people who have used our services. And we'll be able to continue to improve our services by doing that. But I think as we move along, our app will become even more integrated with our data collection.
Great. There's another question about how Foundry is funded and how can we help with this important service?
Yeah, so I think what's also kind of unique, well, I know it's pretty unique with Foundry, is that we are funded through the generosity of donors and through the annualized funding from our provincial government. When I say donors, it's both families and caring families as well as corporate donors. And so all our centers, when our centers are built, they are supported philanthropically. And then a lot of our innovation has been supported philanthropically as well. And so we love the combination of the two. And the provincial government has seen, I think, the value in the model that we have. So they provide annualized funding to our centers, which we then help top up with grants and donations so that we can innovate and provide a broader breadth of service. And then what I should also mention is that in each of the centers, there's existing services that were kind of hiding behind different doors in the community that are brought together. And so, in some communities that amounts to not an insignificant amount of service just in disparate areas. So when we bring them all together, you actually start to get a pretty nice, robust Foundry slate of services from existing and new, pre-existing and new dollars of funding.
Great. And there's a follow-up question from Mark Peltier that can you see that? Do you want to answer it about possible connection with high school curricula?
Happy to connect you to, if you shoot me an email, I'm happy to connect you to our peer support leader.
Okay. And just with the idea of practicum opportunities where they get credit for putting work into, because certainly with all the volunteer programs as well, there are a lot of students looking for something to do to help that can be useful, not just volunteering at birthday parties.
Right. And volunteer opportunities is something that we're still in our infancy in terms of finding the right fit for volunteers. Certainly a lot of our centers, have peer support and opportunities for peer support workers. But we do have university students that work with us on various projects on our research side. And we also have dozens of young people around the province working on our advisory councils and giving input on various activities. And so on our social media channels, every so often there's some calls for youth to participate in those.
Great, thanks. There's another, just a follow-up question on the transitioning out of Foundry care after 25. Is there feedback collected and surveys to get a sense of what the pathways are like for these people who've graduated from Foundry?
Well, we've done sort of focus groups over the years, and we know that various times we've had requests to create alumni because people feel so strongly about what we've done to create sort of alumni groups that people can continue to come back to. Again, it speaks to the culture that is created in our centers with the young people. And I think, unfortunately, a lot of people find the way health systems work as being really suboptimal, and they continue to navigate or be challenged by navigation issues. We do in the province, because of the primary care networks, we do hope that our at least our family doctors are going to shift more to team-based care. We've started to see that, and we're hoping that team-based care will make services feel more accessible. But I think there's a lot of work to be done still.
Yeah, it's definitely no silver bullets for making all this work better. And you've talked a lot about having youth involved in planning the solution and identifying what's most important. How do you plan to keep them involved in the future to improve and enhance the service delivery and the platform experience?
We hire a lot of young people. For one, it's amazing how many youth we have working. We've got a staff of about 140 now, between our virtual service and Foundry Central office, which is the group of people working with our centers, plus all the staff in our centers. And it's amazing how many young people we have working with us now, and they continue to really drive, our values. And I think that what we've come to understand is everything we need to do needs to have youth at the table and supporting the co-design. So I think to answer that question is that we build it into our principles, we build it into our values. And so the value is to have youth part of, in a meaningful way, not in a tokenistic way, part of the dialogue and leading the design whenever possible. So all our centers are really, the design is co-led by youth working with an interior designer. The app had a team of I think about 40 youth from around the province, half self-identified as Indigenous, when they designed the initial app, and continued to be a part of refinements of the app. We constantly ask for feedback from youth when they come into our centers, and I think that will continue to be refined to then identify services that youth aren't getting. But at the main, it's again values driven, and one of our values is that the kind of work we do is co-led or co-designed by young people.
Right. So following on that, there's another question that links to that. So for sure, you've done a lot on the Foundry side to make it open to youth to be involved in all phases of the program. But what makes it appealing to the youth? And are you seeing changes of levels of engagement, or what they're involved in, or what makes it something compelling that a young person is going to want to be involved to take advantage of the opportunities to contribute at Foundry?
Yeah, what we've discovered, I think, is that there are some young people just like who are interested in the environment, others that are interested in debating, others that are interested in yoga, and there's just some that are interested in mental health and see it as a passion of theirs. And so we are really tapping into that group of young people. They do tend to be more young women than young men. But we have other ways of I think, introducing Foundry to young men. But there's no shortage of young people, who are passionate about what we're trying to do.
Great. And another question, just in terms of what the young people care about most, what are the programs and services that have the most uptake, and are there trends in what the leaderboard looks like there?
Well, we're constantly evolving our provincial trans group has been really popular. And that gives young people who identify as trans opportunity to connect with young people from around the province. And so that's been absolutely popular. We have also linked into creating an early psychosis group virtually, which has also been popular. And we also have started to do some mindfulness group work. I think that depending on the time of the year, some groups may be more popular than others. We have wellness groups where folks can do artwork virtually or yoga virtually, but also in person. And those seem to be quite popular. And we have one particular initiative, which has been in partnership with Power to Be, where we try to get young people into the woods, getting out off their screens. And that has been absolutely marvelous. So we continue, I think, to see youth. It's like everything else. Like we want to give young people as many options as possible to engage with us. A Dungeons and Dragons group, super popular, and both and gender fluid in terms of its participation or its participants, and really a great way of engaging some young people that we wouldn't see otherwise. I think we're going to get into more gaming at some point in terms of connecting with young people who game. But we're just starting, so really excited about what we're seeing.
Great, thanks. And on that, there are a couple more questions, and then I think we're going to have to start winding it down. So if you have any urgent questions, this is your time to get them in for a quick answer. But otherwise, we'll be winding it up. But a little bit about the differences between the different age groups, and one around what do the youth care about most, and what are they most interested in compared to other age groups, and then the other is the need for people. What do you do for people 25 to 40, and is there a room for another Foundry-like organization that specifically looks at the next demographic?
I'll tackle that one initially. I think that seniors really need this model. And I think that that's something that we've heard loud and clear from folks, is that this is a great opportunity for seniors. This may also be a type of service for vets. Veterans that often have more complex needs and aren't getting served by the mishmash of services out there for them. To do this in the adult sector is probably best done in communities, and having community initiatives kind of drive this forward. I don't have any skin in the game, so if that's something that the community was interested in doing, I think it makes a lot of sense, and it's a lot of work. When it comes to young people, so our takeaway as we move forward is that we have done this, I think, really strong push, and we've had this strong push with our communication strategy and just our brand to connect with 16 to 21-year-olds. Like that's our kind of our hot spot. But now the challenge, and I think this is the challenge that our leadership team has kind of like put out to our group, is how do we connect with 12 to 15-year-olds? And 12 to 15-year-olds are different. They're just a different ball of wax. And so we really need to think about how we advertise, communicate, market to that group, and then really start to understand how they use technology. So one of our grants, we just had a CIHR grant, was to understand the impact of TikTok, because so many youth in that age group are learning about mental health through TikTok channels. And so understanding how they're being influenced and how they're understanding that material, because that 12 to 15 group, is the TikTok generation. And so they're not so much Snapchat, they're more TikTok. And so it just, trying to stay ahead of it and trying to understand, it's almost like you need a steady flow of funding to just kind of latch on to the latest and greatest and understand how you work with those channels. But it's something that, again, when you talk about technology, social media needs to be considered, because it needs to fall into your understanding of how you're going to work with young people.
And probably half an hour talking to a 12-year-old will teach you more than having 2 or 3 people our age spending 2 weeks doing a report for what actually happens there, and how because it changes from quarter to quarter.
And it's amazing. What I will say too is, so 12 to 15-year-olds have all this access to social media, unfettered access to social media in many ways, and to certain games that it's really hard as parents to keep track of unless you're just going to put a total stop to it. Yet doing the research on that population to understand is probably more challenging. And so I find it somewhat ironic that our ethics boards really haven't shifted over time to make, understanding and evaluating and really researching that group easier. Yet we find ourselves in a world where young people are preyed upon by social media all the time.
That's a good point. Yeah, there's definitely more to dig into there, and it's interesting, how you were talking about the next priority after the youth would be seniors for needing help, because definitely loneliness among seniors is a huge deal, and a lot of other issues. But it's a funny dichotomy because from a happiness perspective, there's a well-documented U-shaped happiness curve where you get progressively less happy into middle age and then happier again into old age, and that's even with the health issues that come with getting older. People still get happier. So on the one hand, there are more people in crisis perhaps, but on average they're happier when they're young and they're old, which is interesting. I'd like, maybe just for our parting couple minutes with you to look ahead and thinking 5 years, 10 years in the future about, on the one hand, what's your anticipation for what the problems are going to look like, but also, from a more inspirational perspective, what you think Foundry is going to look like and the ecosystem that you'll be working in will look like to make more people do better.
Yeah, I think without being too bold, I expect that this model, and it won't be called Foundry, but this model will exist across the country 5 years from now. And we will be able to, look at just a whole different way of delivering services and care to young people in this country. And I think it'll be ahead of almost anyone else. And it's really exciting, but I do think that we may have a federal government who sees it the same way. And so we continue to have our fingers crossed that will happen. And that as we do move forward, because of the way we network everything and we link everything up, then it will really create tremendous opportunities for us to collect data and to have a far better understanding of what youth are liking, what they're not liking, what they're using, what they're not using, where the gaps are. I think it's fair to say that the stigma of mental health hasn't disappeared, but it has improved tremendously. We are talking about it far more than we ever were. I think we can all acknowledge that. There's a comfort level now with talking about it that didn't exist before, but our services continue to be stigmatizing, and the lack of access to services, the need for people to self-diagnose before they get help, the propensity of emergency room visits for mental health with really limited and crappy follow-up continues to, I think, unfortunately send a clear message to people when they do need help that we haven't prioritized mental health services. And so I think that's what we're trying to do with Foundry. We're trying to make it really clear to young people that mental health access shouldn't be challenging and it shouldn't be something that's uncomfortable. And if we do it right, it should feel good. It should feel good, and it should leave you with a better sense of your place in the world. And so that's what we're trying to achieve. And I hope that as we move forward in the next 5 years, we'll be able to provide that shift and that transformation to more communities.
Great. Well, certainly we're willing partners in being a part of that new way of delivering healthcare and engaging people in it. And just want to say thank you so much for sharing your time with us, Steve, and the audience from but most importantly, just thank you so much for caring and for actually doing things and being so committed to this. It's you've done a lot of good things for a lot of people. So thank you very much.
It's a pleasure. Thanks, David.
Thank you. I'll pass it to Marie. Make sure we have any housekeeping.
Nope, just to say thank you to everyone who joined us today, and stay tuned. We host one of these sessions once a month, and our next one will be continuing on the theme of measuring happiness and well-being in healthcare. And so follow us on social media, check out our website events page for updates on that. And I hope everyone has a fantastic day.
Thanks, Marie. Thanks, Steve. Thanks, everyone, for joining.